Hey everybody, it's Ed O'Keefe, and I'm here with my really good friend, Dr. Joe Perry of River City Better Sleep, right here in San Antonio, Texas. Today, I'm super excited because I didn't realize that if you're someone who suffers with sleep apnea, if you snore, if you have ever been told that you stop breathing while you sleep, and there's a slew of symptoms in which we'll get into. Did you know that at River City Better Sleep, they actually can help you, whether you're CPAP non-compliant, you've tried the mask on the face and it didn't work because you just couldn't sleep with it, or you've been told that you possibly have sleep apnea, or any of these things above. I brought Dr. Joe Perry here today on America's Leading Dental Experts to discuss how dentists, specifically Joe and his team at the office, are helping people with sleep apnea. So first and foremost, Dr. Joe, great to have you here.
Thank you. Good to be here.
I mean, this has been exciting. So you guys are helping people with sleep apnea. Now, my first question when I heard that patients can go to the dental office to find out, like, to get help with their sleep apnea, I immediately was like, dentists? So when did dentists, and why are you able to, now I know now, but why are you able to help people with sleep apnea?
Well, it's interesting, I get asked that question every day.
Yeah.
Why am I listening to you? Why am I talking to you? Well, actually, dentists traditionally, we're everything about the airway, the mouth passages, how we breathe, our tongue, oral structures, and things of that nature. So it's something that we deal with every day, day in and day out.
Well, it's actually more common sense because you're looking in the mouth.
Absolutely.
Across hundreds and thousands of people. You're the experts of the mouth. Okay, pretty amazing. So when I was doing some research before I brought you on, what I discovered was that they say in North America and in the United States alone, over 20 million plus people, estimated much higher, go undiagnosed with sleep apnea. So that's pretty scary. And then there's the other segment that they're CPAP non-compliant. So they've done the sleep treatment or the sleep test and they've tried the mask, it hasn't worked. What I didn't know was that people can actually die if they don't actually get their sleep apnea treated. So can you kind of talk to us first on, like, what is sleep apnea and why is it so dangerous? Because that shocked me.
Well, it is shocking, and it's a little bit frightening when you think about it, because it's something that goes on at nighttime. We know nothing about it unless we have a partner that is telling us, hey, you're making a lot of noise at night and it's disturbing my sleep. Or even worse than that, I've noticed that at times you stop breathing. Well, the consequences of not breathing at night are severe.
Yeah.
Because we're just breathing just barely enough to stay alive.
That's right.
And if you just stop breathing at that state, it has severe consequences to all sorts of things in your body.
Well, and I think one of the misconceptions that I had was that the way to identify someone who stops breathing or has obstructive sleep disorders, or obstructive airway, is that they snore. Like, okay, you snore a lot, you're a middle-aged man, you're overweight, you're a candidate. And what I'm learning is that 1 out of 4 men over a certain age are actual candidates, and then 1 out of 9 women, which I didn't know that. Can you go a little bit more into who actually could be a candidate for sleep apnea?
Well, it's interesting. We do have a sort of a stereotype as far as who would be a candidate, and that's not always true. It's just kind of a profile, if you will. We know that middle-aged men, they're a little bit overweight, tend to have a tendency to have sleep apnea. We know that ladies over menopause are more prone to have sleep apnea.
Is that right?
Something that we see.
Oh, wow.
But it's not always true. You always don't fit the profile.
Yeah.
So anybody can have sleep apnea, and one of the hallmarks, of course, is snoring. That's just one of the things that we know about, but it's not the only thing. and your oral practitioner, your dentist can look in your mouth and see all sorts of things that are indicators, not diagnostic, but they're indicators that there might be a possibility.
Yep.
And make recommendations that maybe you should consider being tested for it.
Okay. I want to talk about the indicators. You had mentioned that when people stop breathing, their body will wake them up. Is that accurate? Or sometimes?
It can be subthreshold. For instance, your heart rate may go up. Mm-hmm. You know, your blood pressure, things of that will happen. So that triggers systems in our body to turn on mechanism because your brain thinks you're awake, and you may not be awake.
Oh,
and so it turns on mechanisms, and then we do things like middle of the night. Many times you have to use the restroom where normally you wouldn't.
Yeah.
You know, one time a night is not such a big deal, but if you're getting up 3-4 times a night to use a restroom, well, that's your body's telling you something, and it's basically saying, I don't think you're sleeping.
Wow.
So I want the normal daytime mechanism to kick in.
Yeah. So what shocked me, scared me, was that with people, because a lot of people, I mean, folks, I don't know if you knew this or not, but I was telling a great story before we got on camera about a friend of mine, overweight dentist, passed away because of sleep apnea. Like, he just didn't wake up the next morning. And then what I've kind of learned is that people technically don't live as long, and if they have sleep apnea. And then my question was well, why is that happening? So what's happening in the body when people have these issues?
Well, if you consider the fact that what I said before, you're just breathing enough to stay alive.
Yeah.
Try letting your air out and then holding your breath for 10 seconds. And then holding it for 10 seconds. Well, the sleep apnea is categorized by not breathing for 10 seconds, but some of us go 20 seconds, 30 seconds. I have some patients where we have documentation that they don't breathe for 60 seconds or more.
You're kidding me.
Your oxygen levels drop dramatically when something like that happens. So your heart, speeds up. It's trying to get oxygen to the rest of your body. Your brain is saying, breathe.
Yeah.
All sorts of things begin to kick in. This puts a lot of stress on so many systems in our body that's where we see long-term cardiovascular problems.
Right.
We see higher incidence of stroke.
Yeah. Can you explain why that is, just for our listeners? Because what I understand is the heart starts to enlarge, correct?
Well, you're beating faster, your heart, yes, exactly, it begins to enlarge. Your blood pressure goes up because it's just pushing the blood around your body, and your blood doesn't have the oxygen that it needs, and so your heart says, speed up some more.
Yep.
Go some more. This puts pressure on your circulatory system, which long-term can lead to premature stroke, premature problems in that nature. All the sorts of system breakdown that can go along. There's just a litany of different things that studies today are showing are linked to sleep apnea.
Yeah.
And by addressing it early will help lessen those things and can lessen some of the symptoms and problems that you have.
Are we talking about comorbidities like high blood pressure, type 2 diabetes, other issues? So this is kind of, when I was reading about this, kind of shocked me. This whole topic is amazing to me because is it a chicken or the egg thing? Do I have high blood pressure, that's why I have sleep apnea, or do I have sleep apnea and now my blood pressure is high?
Well, it's really a combination of the two.
Okay.
Because sleep apnea can exacerbate or make worse problems that you already have existing.
Yeah.
And it can probably initiate some problems that will worsen as time goes on.
Yeah, because the people that tend to have high blood pressure tend to have a lot of other issues as well, and so it can cascade. Okay, so then the magic question is, okay, Dr. Joe, how do you help solve this for people? And if I'm somebody who's watching right now, and I'm like, yes, doc, you're describing me. My wife says I snore too loud, or I'm the wife, and my husband says I snore too loud, I stop breathing, I'm fatigued during the day, I get up too many times at night, maybe I'm cranky and moody because I'm not sleeping well.
Tired, fatigued.
Tired, fatigued. I mean, there's a litany of symptoms, folks. So how do you solve this without a CPAP? Or what's the right question I should be asking there?
Well, the first thing that we have to do, if we don't have it already, is we have to have a sleep study that's interpreted by a qualified sleep physician.
Okay.
And then that produces a diagnosis, and it gives us an opportunity to determine just how severe
it is.
Your symptoms
Okay.
are. And then we look at...
Can I ask a question? Do they come in and see you first, then you do like the initial, and then you help them find the right?
In many instances, I do.
Okay, great. So folks, good news is you don't have to do anything yet. He can help and guide you through this process. I just want to get out the whole process. That's great.
Yeah. Many times I get referrals from physicians for this. However, many times people come in just seeking advice about sleep apnea.
Unbelievable.
And then we can help them get tested.
Yeah.
And find out the severity.
Yeah.
And then we go about determining what, for everybody, the answers are a little bit different. And it depends on a lot of factors to each individual. And so we tailor a treatment plan according to what their needs are.
What they're at. Okay, cool. Now, I've heard of, is it oral appliances?
Yes.
Okay, so how do oral appliances help with sleep apnea?
Well, first of all, what we have to, what's important for us to understand is that the problem with sleep apnea is usually is a blockage of the airway.
Got it.
And the blockage of the airway is caused by a relaxation of the muscles in our throat that keep our airway open during the day.
Yeah.
They relax at night when we sleep. At the same time, our tongue and our jaw relax, and the tongue falls back and closes the airway, and we stop breathing.
Wow.
So the CPAP uses forced air. It literally blows air down your throat to keep your airway open. Okay.
Yeah.
So on the other side of that, when we do it with dental device, we use a device that gently holds your jaw forward. Now your tongue is connected to your jaw.
Okay.
And if we hold your jaw forward just a little bit, that opens the airway and allows you to breathe and doesn't allow your tongue to obstruct the airway.
Got it. So just by simply moving my jaw forward slightly with an appliance, everything else kind of gets in the right alignment.
That's exactly
Okay, cool. That's a good way of putting it. Because, what's crazy, folks, is like 74% of people who try CPAP become non-compliant, which means they don't use it, right? So what I love about talking to you today is that I hope people out there see us, like, everybody watching this right now has a family member, has a cousin, brother, aunt, uncle, that 1 out of 4 men over, what age is it? Is it 45, or do you know the exact stat?
I want to say 35.
Okay, have some form of airway obstruction, and 1 out of 9 for women. And it's, I think people are kind of lose hope when they've done the sleep study, they've come through and they've done the CPAP, and it's not for everybody, right? And so where they can come in and see you and see if there's an alternative path and plan that's not so difficult. So awesome. So glad to have you here. So do you mind, can we talk about fees and cost? And I would imagine you get a lot of questions about insurance, Medicaid, Medicare, and what's the cost of the process?
Well, what we do find is nearly every medical insurance company will cover the treatment for sleep apnea to some degree or another, and every plan is devised a little bit differently.
Yeah.
And everybody has a little bit different things, like oh goodness, I got in a blank here.
That's okay.
Yeah.
Well, everybody's plan's different, and so and I would imagine that different insurances cover different parts of it.
Exactly.
And then also, since sleep apnea falls under medical, right?
Yes.
And you also have like high blood pressure in these other areas, you you'd go through medical billing as well to see what it will pay for. Is that correct?
That's
Something
correct.
like that? Okay,
That's
great.
correct.
That's amazing. That's amazing. And then worst case scenario, if their insurance isn't covering it, because or the medical billing only pays a portion of it, you know, I always like to tell people, like, you're already paying the price. You're already paying the price right now. So whatever the fee's going to be is not nearly what you're already paying. Okay. But then there's also financing options and there's installment options, is what I've heard.
There are all sorts of ways to finance getting this kind of treatment done if you have no insurance at all. The interesting thing about it is that the oral appliance at about the year 2 becomes less expensive than what the ongoing costs of a CPAP are.
Oh, really?
So actually, in the end result, it's less expensive than the ongoing expenses that are even monthly expenses for a CPAP.
Yeah. Well, but I mean, I'll tell you, man, the cost of not waking up sure scares me. I mean that's something there. I don't know what that's worth, you know.
Well, I can tell you from personal experience because I am a sleep apnea patient myself.
Oh wow, I didn't know that.
Yes. It started early for me, and nobody expected it. Nobody, because I was in good health. I felt like I was in good health.
Can I ask how old you were at the time?
In my mid-40s.
Yeah, and in mid-40s, we all think we're invincible.
Oh
so.
yeah, absolutely. And I took that stance, and I basically denied that I had a problem. I just felt like no, that can't be me. So I was, and I think I'm kind of speak for a lot of other men. Just deny it. I'm too good a health. That can't be me. That's somebody else.
Yeah.
I did get very strong persuasion that no, that's not true. You are making a lot of noise, and we won't be sleeping in the same room if this continues.
Is that right? Yeah.
Yes, yeah. So I had to kind of change my way of thinking a little bit, and in the end, I found out that yes, it was indeed true, and that was back in the days when I had to go to be tested in a laboratory and hooked up to a whole bunch of apparatus and sleep in a strange bed. To do that. Nowadays, of course, that's not true. We can do these kind of tests at home.
Okay, well, let me stop you there. So our viewers out there, because I don't think everyone knows that, right? I didn't know that. I thought everyone had to go to a sleep lab. And so you're telling me people can do the sleep test from home?
Absolutely. We have the tests over the years have become much more simplified, and you can wear just a small apparatus at nighttime in your own home and be tested. And nowadays, and that information can be read by a qualified sleep physician, and with diagnosis can be made and recommendations, and a treatment plan can be done. And it's relatively simple.
That's great. That's great. Okay, so back to your story.
Okay. Well, I tried the CPAP.
Yep.
And I just could not wear it. I tried. By then, I was kind of convinced I needed to do something. I changed my thinking, and I tried to wear the CPAP, and I could not wear it no matter what I did. In the middle of the night, I'd take it off, not even meaning to. I had trouble going to sleep. Leaked, it gave me all sorts of problems. I tried everything.
Wow.
And finally gave up. And it wasn't that long afterwards that I became aware of the dental device that, as I described earlier, held my jaw forward. And I found that the comfort level was so much different, and I could wear it. And that's when I really became convinced that it works, because all of a sudden I felt different in the morning. And I was refreshed. I got a good night's sleep, and it was a remarkable difference. And I never would have known the difference had I not tried the device.
Yeah.
You just don't know.
You would have thought, okay, this is just what happens as I get older.
Yeah, I thought it was just part of life.
What I got to do. Yeah,
I thought that's what it was.
Before we wrap up, this has been amazing. Do you mind sharing? One thing you said there was actually really interesting. Sleep apnea does not. It just jogs something. Sleep apnea does not wait for vacation for you to have time to come into the dental office. It's going to be there during like holiday times. It's there during the summer. It's like you can't. It's not like you can just eat or you can't diet it away.
Yeah.
You can't exercise it away. there's only one really path, is to have something that frees your airway and allows you to breathe. Yeah, pretty amazing. Do you mind sharing one or two examples of patients, obviously not their names, but examples that people can relate to of they had a certain symptoms or issues with sleep apnea, they came to your office, and what was the outcome there?
Okay. Well, one comes to mind, a lady that was in my dental practice who I was considering making something for her because she was grinding her teeth at night. That was her very chief complaint, grinding her teeth. Grinding her teeth. So and as I talked a little bit to her, I started getting a few more symptoms. Now, looking at her and observing her mouth, different things that I was looking at, I did not suspect sleep apnea. But because it was so much on the top of my mind and my agenda, I said, before we do this, why don't we test you, have a test done, and see how it comes out, so that we know what there may be another reason why you're grinding your teeth at night. So the test came back, and she was severe apnea. So we made her an appliance, and she came back a week later, and she says, "Oh my gosh, I can't believe it. I'm no longer getting up 3, 4, 5 times a night to use a restroom. I'm sleeping through the night.
Yeah.
I never knew what it felt like."
That's
It
amazing.
was just absolutely incredible. And now I'm getting referrals from her urologist,
Oh, wow.
to treat patients.
That's amazing.
And physicians and things are sending because of the kind of results that we're getting.
Awesome. So if people want to come in and see you at the office, do you offer any consultation, or how does it work at the office?
Any what?
Consultation?
Oh yeah, we do free consultations for something like this. I think it's so important for people to, first of all, so many of us are reticent to check this out. So we do a free consultation for people so that they can sit down and discover whether or not they have issues that should be investigated. And we take appropriate action as far as if they need help getting tested. And then we sit down and talk afterwards about what kind of treatment might be most appropriate for them.
Yeah, I love it. I love it. Well, this has been great.
Yeah.
This has been great. So, hey, everybody, if you've been watching this and you're right here and you want to come visit Dr. Joe and his team at River City Better Sleep, just simply, there should be a link somewhere below or above or in the comments. Click on it. There might be a small little survey, or just give his office a call, book the free consult. There's no pressure, there's no risk. You're in great hands with someone who understands and sees people just like you. The one thing you can't do, though, is, like I said before, you've already paid the price. Don't make the mistake of putting this off and hoping it gets better. At least you rule it out if it's not the case, but you have a free opportunity to come and finally rule it out, so you can like, no pun intended, sleep better at night, and get that energy back and feel confident that you're making the right choice. So, Dr. Joe, thanks so much. It was great having you on the show, and thank you, everybody. Hope to see you on the next episode.